It is said that imaginations over the coming years will be overshadowed by a virus that took fewer than 100 days to shut the world down. But what are the early lessons learned from the novel coronavirus, or COVID-19? To help us unpack this, I'm joined by an esteemed panel of experts this evening. WHO Country Director, Dr. Charles Segu-Moses. Good evening, sir, and welcome.
Good evening, Denver.
I'm also joined by Dr. Eric Juban, Country Director for CDC. Good evening, Doc, and welcome.
Thank you.
Last but not least, I'm also joined by public health expert, Dr. Ahmed Azadeh. Good evening, Doc, and welcome.
Thank you very much, Denver.
Dr. Segu-Moses, I would like us to get straight into it. For many of us, there's been a lot of overlapping between our personal and professional lives regarding our experience with the virus. Personal encounters have been intense. Please talk to us about the disruption of life, the emotions involved, and what your experience has been.
Thank you very much, Denver. As you know, COVID really affects or has affected everyone. And so whether it's your professional life or private life, you realize that there's somebody out there you know who has been affected, either directly in your family or friend or someone like of the sort, very close to you. And I'll give you two of my own examples, where a very dear friend, a colleague, a very senior doctor who died from COVID. And unfortunately, his funeral had to be organized virtually. So normally I would have loved to go, but I couldn't go. I had to join in virtually, and the effects that had on me. Now, another one was a cousin of my wife who also died from COVID. The same process. So these are the funeral also done virtually. Now, how do we console, sympathize, and encourage one another when these things are happening? You know that this is direct, and it affects you as an individual. So apart from professionally, seeing as a doctor, you encounter many of these things. But then when it hits home with a relative, a dear friend, then it means something. What it means is that this is real. It's not a story. We are not talking about figures. We are talking about real people who mean a lot to us and our loved ones.
Thank you for sharing that, Doc. Dr. Juban, what has your experience been thus far?
So when this all started and came together, we had the option to go back to the United States. And my family and I chose to stay here. And we think that was the right choice. We're glad that we're here, glad we're able to continue to work with Namibia on this pandemic. But last month, my mother became infected, and it was hard. It was scary to be here so far away and not to be able to be there. This is what Dr. Charles is talking about. This is what the world is experiencing, not just sickness and pain, but that separation from your loved ones when they need you the most. That was really hard. Praise God, she recovered, even though so many in the world haven't. But we'll occasionally hear people talking and saying things like, we should just let the virus run its course. We shouldn't try to stop it, just whatever nature intends. It's sad, because I don't think anyone would say that if it was really one of their loved ones suffering this. And thankfully in Namibia, we haven't had any deaths yet. We want to keep it that way. We don't want people to have to know that particular isolation that goes with that sort of a thing.
Thank you for sharing that, Doc. Doctor, what has your experience been thus far?
Well, I think it's, from the Namibian context, it has always been something that is a little bit apart from us. There is a separation because it hasn't reached those numbers yet that you often every day meet someone who has either recovered from it or has a family member affected by it. In the clinical realm, one of our nursing sisters had it and has recovered, and we still work with her. So I personally have seen that. But in speaking to family, friends who are not in the medical realm, it's still something that is displaced. At the moment, it's something happening in Walvis Bay. What I do like at this stage, which we can continue with, is that we name, not names, but we describe every individual. So it's not just a number, it's an individual with their age, where they are, how they caught it, etc. So it becomes more real. But internationally, a lot of my colleagues, they have family members who've passed on, who've been infected. So it is real. It is out there. it's all about, doing the best we can right now with and moving forward. We're at the fortunate position where Namibia is still in a good position, and I think we do have the opportunity to really make a difference here.
Part of the sad reality attached to COVID-19 is the stigma. From your perspective, where does it come from?
With most threats that are unseen, like nuclear threats, radiation, and it's the same with a viral infection, because it's unseen, we can't see the threat, and that's where the fear comes from it. So a lot of it is because it's unseen, it's unknown, and there's a lot of misinformation as well out there. So at the moment, there's, this is something that I've been battling since the beginning, is just the misinformation, helping people put things in context and stay humble, because the information, the goalposts are moving all the time. What we take for granted now changes in a week's time as new evidence comes out. So it's all about, staying level-headed, humble, and respond with the best information we have right now. And unfortunately, that information isn't always clear, so there is a lot of stigma and a lot of fear still out there.
Thank you. Dr. Juban, where do you think the stigma emanates from, and how can one deal with it?
It's fear. Stigma always comes from fear, right? Like my colleague said, fear of the unknown, fear of the unseen. So people are still worried that somebody with COVID might bring that harm into their own family and such. We don't need to be afraid of this virus. We need to respect it. We need to know what we can do to reduce our risk and work together on that. That will help protect all of us. These masks that we're wearing right now, they're not comfortable. We don't love wearing them, but we're doing it to protect each other. I think a lot of people don't realize you're not even wearing the mask so much to prevent the virus from coming to you, is to make sure if you have it inside you, you're not spreading it to people around you. It's a sign of caring about the people around you. Those are the things that will get us through this pandemic, not stigma.
Doctor, from your perspective, how can we overcome that fear, very briefly?
Actually, in addition to the fear, the uncertainties that you don't know, and we do not know much about it, but also to think that, look, we don't even have a medicine for it. You don't have a vaccine for it. So then people say, well, if I get it, am I going to die? One. Then you see many things happening. People get it and get very sick, and etc. Then there is also misinformation, where rumors and all kinds of things. This is why I think the effort made by the government of Namibia to have the COVID Communication Center is a brilliant one, so that at least we have the information out there to address the rumors. So getting the right information and then getting it from the right source to assure you that this is it, this is what we know, this is what we can do about it, will give you that comfort and take you a little bit away from the fear and uncertainties.
Very well, Doctor. One of the first lessons for governments was underlined and articulated by Michael Ryan, the Executive Director of the WHO's Health Emergencies Program, when he said, "Be fast, have no regrets. You must be the first mover. The virus will always get you if you do not move quickly. If you need to be right before you move, you will never win. Speed trumps perfection." What do you make of those sentiments?
I'll take it from the word speed. This virus has come to us with such a speed, at such a scope, such a scale, and with such a smartness that is unprecedented. I give you an example. As we sit, we are about 9.5 million cases in the world, almost 500,000 deaths. But you know what? It took us the first 1 month to get 10,000 cases. But it's taken us the last 1 month to get 4 million cases. So on the average now, we are looking at 1 million cases a week.
But could that not be that we're testing more and therefore we're establishing the spread of the virus?
But also the speed. and now it's all over the place. You see, so this virus is running very fast, and this is why we have to be fast and smart. Now, if you look at a country like Namibia, Namibia was very fast in addressing this virus. In the first place, Namibia was expectant. They had prepared. You would remember the various visits His Excellency, the president, went around inspecting. This was way back in February. So when we were hit in March, we had some level of preparation. And then immediately, the decision of declaring a state of emergency. So it gave us that space to organize ourselves. That is why within the first 4 weeks, we had only 16 cases. Then we had 45 days of no case. Then we started getting the increased number of cases when we started opening up. Now, all is telling us is that if we are surgical in our approach, we can salvage a lot of things. And this is the meaning of what Mike Ryan is saying. Act fast. It's better to act fast, even if you make a mistake, than doing nothing.
Thank you.
You cannot have a perfect state.
Dr. Juban, what do you make of that sentiment? If you need to be right before you move, you'll never win.
No, we have to be fast against this virus. It's taken the world by surprise, and Namibia was very fortunate to not be one of those very first countries affected. We then had time to do preparations, and then once we got our first cases, we were able to act fast, like Dr. Charles said. I was looking at the numbers. It took Namibia 103 days to go from our first case to our 100th. In America, that was 44 days. In Italy, 23. In South Africa, 13. In Iran, 7. So we had a much longer time from our first to our 100th case to prepare ourselves, to make sure the health system was able to be resilient, to be prepared, to know what was coming, and have healthcare workers that could address the challenges that came to them. That was very valuable time. We don't want to lose that now. We want to build on that foundation. And it took fast action. And sometimes when you move fast, you do have to go back and alter the recommendations. That's okay. I was giving talks back in February and March where, for instance, I said, as far as we know, you are not likely to spread it until you have symptoms. Then new evidence came out and said, no, you probably can spread it before you have symptoms. We have to act on what we know and do the best we can. If we wait until we have every answer, we'd still be sitting around because there's still a lot we don't know about this virus.
Apart from swift action, what else do you think contributed to Namibia's success thus far?
Well, it certainly helps that we have a large country where people are generally spread out. We have good regional health teams that have been very focused on doing their job well. We have some infrastructure. Development partners have been working with the Ministry of Health, for instance, on telemedicine options for years now for things like HIV. So we have this platform where we can have video conferences with regional health teams all across the country. We started using those immediately for COVID preparations, even before the virus was in this country, so that people knew what to look for and such. Those things made a difference too.
Does speed trump perfection according to your perspective too, Doctor?
I find it funny that the word says trumps perfection as well, and most of the criticism for the Trump administration has been how slow they were to respond to it, and now they're sort of seeing a lot of these outbreaks in the U.S. itself. So I definitely think speed is important, and Namibia moved exceedingly quick. We had the opportunity to actually look around and learn from the rest of the world. So we were in that fortunate position where we could observe and realize how quick we needed to respond to this. There was a lot of criticism initially on how quickly we shut down for 16 cases. That was nothing going on. There was a lot of criticism. And at the same time, the message seems to be out there that now that we're getting cases, it's a sign of failure. It's not a sign of failure. It's expected that we will have cases and that the cases will rise. How well we manage and isolate and trace and contact trace that is the sign of the success. It was a misconception that we could keep this out and that now we've opened up and now we're getting cases, so that's a failure. It's not. It was part of the design, and now we just need to execute the preparations.
Dr. Shogula did earlier this evening say, when he gave us the update, that the cases in Walvis Bay appear to have happened and transmitted during the lockdown period, which means that people were not complying with the regulations. How important is public trust as government's most valuable asset to curb the further spread of this pandemic?
It's immense because the economic fallout is huge, and as a country, we took guidelines or took measures to really try and slow down the spread and prepare for the eventual first wave and subsequent waves. But in doing so, a lot of it, the person on the ground who has to go out to get water, for example, has no ability to wear a mask, can't self-isolate. They're in a house with many, many people. So a lot of the measures need to really understand the populace and the realities of the population. And if that disconnect is there, the trust will be gone and the measures will not be effective. So communication and helping the entire country, understand the dilemma we're in and the response and the reasons for the response. I think more information and more substantiated and good information is always going to help develop that trust.
What do you make of those members of the public who are able to afford a mask, who are able to practice social distancing, but who do not comply?
That's a difficult one. I mean, we have this is a disease that's bringing out a lot of human nature and a lot of society's inequalities. The people who are really affected by this virus are not those who can afford to be affected by it. We see in most countries it's the economically poor, those who can't social distance, etc. And so on the other hand, those who can, who don't comply, who sort of sweep this under the rug, it's just a slap in the face, really. We have these guidelines, we have these measures to really, wearing the mask, as Dr. Juban has mentioned, it's an altruistic thing. We're doing it to protect the community, each other. It doesn't really protect you yourself, but everyone does it to protect the others, and inadvertently we all protect each other as a community and as a country. So the message needs to go out that one person getting it, even if he's a domestic worker in the informal settlement, it will still affect the whole country, and you in your sort of capable area where you can work from home, etc., will still be affected by it. So we all need to be responsible.
Thank you very much, Doctor. If you want to participate in tonight's conversation, if you have a question for one of the panelists, the number to dial is 061 291 3339. That's 061 291 3339. Please remember to switch off your television set or your radio to avoid any confusion. Dr. Juban, I'd like also to gauge your take on the importance of public trust to help us fight this pandemic, but also to help us salvage the economy ultimately.
It's essential, and there's some analysis out there now showing that countries where generally the public trusts its government, where there's that understanding, they feel that they're getting accurate information, they're doing a better job overall of controlling it. There's a lot of factors that go into that. Some countries were hit much harder, faster, but ultimately they've been able to bring down their curves more because the population, the community has a sense of solidarity, and they're looking to government and they're trusting the message they're getting. So I think that's what we want to see here in Namibia. And it's great to see that the cases are reported immediately, that Namibia's leadership wants the people to be fully informed. That's why it's great that we have shows like this, that we have the communications center, because there's nothing to be hidden. We're all in this together. There are countries that have stopped reporting their COVID data completely. That might look nice on a chart because it looks like there's no new cases, but it's actually very concerning when that happens because then you don't really know what's going on. And how can communities make their best decisions then?
Dr. Sego Moses, what do you make of public trust as our most important commodity right now?
No, trust is earned. You need to earn the trust of the populace. And that will come about from the point my colleagues have made. when there's openness, transparency, and accountability, then the populace know that you are telling them the truth. One of the good things that this country has done is community participation and engagement, and adapting what we call the all-government and all-society approach, where it has involved everybody, and so we are all part of the solution. So private sector, public sector, everybody is in it.
Doctor, just one moment, please. We've got Winston from Walvis Bay on the line. Good evening.
Good evening, sir. How are you?
I'm doing well, thank you. Under these new normal circumstances, how are you?
I'm very well. I'm very well, in fact.
Yes.
I've got a couple of questions where I really struggle when it comes to the Namibian lawmakers and so on.
Please keep them brief, Winston.
Okay, I'll keep it brief, and then I'll just cite the other points, and maybe you can discuss it. My question is with regards to the test itself, compared to the rapid test that is in the UK and Australia, and I know there's the gentlemen there, they're all aware of that. I want to know, how do we check the accuracy of these tests? How do we know if the positives that we are getting are not false positives? Because 99% of the cases in Namibia are asymptomatic. Normally, we don't get that with the disease. They are all medical doctors, I presume. Perhaps they can tell us why that is this disease. Out of all the other diseases we know, only this particular one has the case where 99% of the people are asymptomatic. So only the test says that you are sick, and WHO says you are sick, and the government says you are sick, but you are asymptomatic. And then the 1% that do get sick actually, right? And they only do that if they have an underlying condition. So we don't know is it COVID-19 or is it something else. Those ones, 98% of them get better, right? Is this fear mongering by the WHO? Is this why WHO has rejected Madagascar's medicines, even though we've got pharmaceutical drugs which are more dangerous?
Thank you, Winston.
Hang on, just one more thing.
No, if asked three already, we need to give others a chance too. Thank you very much for your contribution. Dr. Sekumoses, I'd like you to please continue where you left off, but also please address these concerns, questions.
Okay. So when we are all working together, then it's easier to build that trust and confidence in the system. Information is given on time. You know that what you are getting is correct. Now, leading on to what you are getting is correct is the question of Winston. Thank you very much for your question. I would just like to know where you have the 99% of cases that are asymptomatic. It will be interesting to know your source of information. But basically, when we have various tests, and in Namibia, the test we are using is a PCR test, which actually tests the presence of the molecule of the virus in the swab sample that is taken. So if the virus is there, it would be detected. Whereas we have the antibody test, which would test your reaction to the virus. And that one, because it takes time for the body to develop antibiotics, sometimes the virus may be there, but the body would not have developed antibodies. So you may have the virus, but then the results may be negative. So these are basically, in broad layman's term, the difference that we have. But in Namibia, we are using the PCR, and also, the gene test also tests the molecule or the virus itself. So, and we also have quality assurance done on the samples.
Essentially, you're saying it's not fear-mongering, Doctor.
No. The information that is given to the public is accurate, and that the quality assurance gives us that comfort.
Thank you, Doctor.
That the result that we are getting is reliable.
Thank you very much. We've got Ernest from Windhoek on the line. Good evening, sir.
Good evening.
Yes.
Yes, I just wanted to make a contribution or a question, rather a question. I was yesterday at Chomisa police station as well as today. Amongst the police officers who are behind the counters, there's no social distancing, and even you don't see any hand sanitizer. So how does that work? I just want to ask that question.
Thank you very much, Ernest.
Okay.
Dr. Juban, you may not be privy to what's exactly happening there at the police station, but just a general remark about such an instance.
Yeah, I think it's good that Ernst noticed this, and we want the community to notice when there's places where we could be doing better. So hopefully that can get raised. Certainly we can bring it up to other people in the COVID response. We want to make sure that all the different public sectors as well as private sector businesses know what they can be doing to keep themselves safe and keep their stakeholders safe. If you have to go to a police station for some business that needs to be taken care of there, you want to feel safe while you're there. We want to make sure that the people working in that police station have the supplies they need to be safe. If I could jump back to Winston's claims for just a moment, because I want to make sure that anyone watching tonight hears the accurate information, just so it's clear. There are many people, we don't know exactly how many, up to half, somewhere around half, who get this virus who have no symptoms at all. That's somewhat unusual, but there are other viruses like that too. And we can understand, it goes back to that previous question of trust. You can't see the virus, and if you're not getting symptoms from it, if you don't trust your government or WHO or CDC or the laboratories or your doctor, you might really question whether you have it or not. So that trust really does matter, and our ability to explain to the public what's being done. For instance, in Namibia, we do very good quality controls on the testing. I'm quite impressed. I see it myself, so I get to see it with my own eyes, and I know most Namibians don't. But if you see in the laboratory, they do great quality measures. They're only using the higher quality test here. And no test is perfect. No laboratory test is perfect. People should know that there's always the possibility the test could miss an infection, especially if you just got infected very recently. But these tests, it's highly unlikely they would ever have a positive result for someone who doesn't have it. It's just not the way they work. So we want people to feel that trust and know that there's no conspiracy there, while understanding that we're doing the best we can with the tools that are available.
Thank you.
And Namibia has done a good job with this.
Thank you very much. We've got our last caller on the line, Martin. Good evening.
Hello, good evening, sir.
Yes.
How are you?
I'm doing well, thank you. How are you?
Very well. I can hardly hear you.
All right, we can hear you clearly. Please keep it brief.
Okay. My point is actually that I got only an advice. As we are suffering from this disease that is striking our country on one side of the country, or maybe it's still coming to both sides of the country, I was of an opinion. Can the government not suggest a voluntary testing for everyone so that we can maybe find out who is affected or who is not infected? Because this thing of just staying and then you are only being tested the time of when you are quarantined or something, it's really not effective enough. I mean, it's not
Thank you very much,
efficient.
Martin. Doctor, would you like to respond to what he's raising?
Okay. I think it goes back a little bit to even Winston's question where he brings up the point of rapid testing. So the point of a rapid test, as Dr. Sagio Moses mentioned, it picks up your antibodies. And for it to actually be effective in a community, you need to have sufficient prevalence, or what we call prevalence, in terms of there's enough people with the infection. So if you test everyone, you're likely to pick up some infections. Otherwise, that test is more likely to bring false positives because it can react to other types of coronavirus, not COVID-19 as well. And if there's very few people in the community, you're doing a lot of testing just to get a lot of fake positives with the rapid test. With the PCR tests, our dilemma right now is we actually have a short supply of it. The swabs, there's a shortage of swabs, there's a shortage of reagents. So we do have to have very selected, high index of suspicion cases where in the beginning, very early on, you had to have a positive travel history or contact with someone to be tested. So even right now, if we were to test in Windhoek where we genuinely suspect there is not much community spread or any community spread, if we were to do testing over the whole of Windhoek, we would use a lot of our reagents, a lot of our swabs, just to get an idea that there's nothing going on right now. But tomorrow or the next month, when we start to get those waves or infections, then we would have to retest. So it's all about strategically using your resources in the best manner. And
Thank you, Doc.
I do think we're doing that.
Let's talk about the latest medical developments. We do know that human trials in the development of a vaccine have started in South Africa and the UK. How significant is this?
Well, this is what everyone believes will be the golden ticket, for example, of getting past this to past COVID-19, so it becomes a thing of history, will be a vaccine. And there are over 100 vaccine companies sort of working on different vaccines, but 10 of them, I believe, are in actual human trials right now. The difficulty will be to get one that actually shows enough efficacy or it works, and then to produce it and roll it out across the entire
Why would that be
world.
difficult?
Because our capability of producing 7 billion vaccines is limited as well. And right now it's a massive, I read today that it's a $30 billion industry, whoever finds this vaccine. So I hope that these companies are sharing their information as quickly and as possible. But there is always that capitalistic nature where that stops, and that may be what delays us as well.
Thank you.
So everyone's looking for that
The golden ticket.
that golden ticket.
Thank you very much, Doc. What do you make of these developments? And as close as in neighboring South Africa?
Yeah, so there's Oxford University joined together with a pharmaceutical company, and they're testing one of their vaccines that's further along down the pipeline. It's in these large-scale human trials, and South Africa has agreed to take part of it, and people there can volunteer to try the vaccine. It's already started. That volunteer word is very important. I think some people get scared that they'll be used as guinea pigs for some sort of a research. This is entirely voluntary, but it's actually a really good thing for an African country to be a part of this. I read 2,000 volunteers in South Africa, 4,000 in the UK, 30,000 in America, and several other countries as well. We want a whole picture of how this virus works and how a vaccine might be effective against it. We want Africa to be a part of that story, because when there is an effective vaccine, we want African countries to have full access to it as well.
Thank you. Dr. Segu Moses, from the perspective of the WHO, is this a step in the right direction?
Indeed, it's a step in the right direction, and the WHO is very much in favor of this because having a vaccine is a way to go. And that this, what is happening in South Africa is actually what we refer to as phase 3 of the clinical trial, where they are actually testing for the safety of the vaccine, the efficacy, and the ability of the vaccine to produce the immune response.
Thank you.
Now, it is going to be a game changer, as my colleagues have said, because once we're able to do that, then we can provide that protection to prevent the disease and the spread thereof.
Thank you, Doctor.
But also, there are a number of, in fact, there are about 16 vaccines which are in what we call the clinical evaluation. And they are all running to get the solution.
Thank you, Doctor.
So the world is in earnest desire to get an answer.
Thank you very much. Gentlemen, we've run out of time. Just very briefly, Doctor, a message of hope for Namibians, but perhaps also urging Namibians to comply with the regulations.
Maybe I can just reflect what Dr. Zubin said, that this virus is not something to be feared, but to be respected. In reality, the vast majority of us are going to be fine. There will be a few who will struggle with this.
Thank you.
And it is something, but we will be able to get past.
Thank you very much. Doctor, from your perspective, very briefly?
I get hope from seeing Namibians be united. And I think the quickness, not just of the government's response, we talked about that, but the speed that Namibians really came together to have solidarity and to try to get the right education about this, it gives me hope.
Thank you very much. Doctor, you've got 10 seconds.
It's a solidarity and unity, pulling in one direction, that we would overcome this.
Thank you very much.
The hope is that
Thank you, Doctor.
this crisis would help us to take opportunities that will lead us forward as one Namibia.
Gentlemen, thank you very much for your time. Thank you for sharing expertise. Continue the good fight.
Our pleasure.
Thank you.
Thank you very much.
Thank you, Doc. Fellow Namibians, not only those in Walvis Bay, let's try our best to comply with the regulations. They're there to protect us and also to protect the economy. Remember, together we are better. From all of us here at the NBC COVID-19 Update Desk, it's good night and goodbye.